some real world advice, a safe place to go where you're treated right. We're all in the same boat, come on, take some crib notes. We're all in the same boat, come on, take some crib notes.
So what is a fever? A fever is an abnormal rise in body temperature that's a sign or a symptom of something happening in the body. That can be many things. For us in pediatrics, the overwhelming majority of fevers that we see are caused by viral infections. But sometimes it's from bacterial infections like a strep throat or an ear infection, a sinus infection, a tick-borne disease like Lyme disease. Sometimes it's in response to immunizations. We often will see fevers after immunizations. And sometimes there are other rare things like different types of rheumatologic disorders or more chronic conditions. But those are the more rare fevers that we see.
Fever is distinguished from hyperthermia, which is the body's elevation in temperature when it can't thermoregulate anymore, when it's just reached its maximum and it can't find homeostasis. This sometimes happens when people are in environmental temperatures over 95 degrees. Fevers, on the other hand, are your body's immune response.
Yeah, and for us as parents, that's generally the first sign that our child is sick.
So what degree in temperature do you consider a fever?
Right, and we're asked this often, and some of this is age dependent. So when we're thinking of young infants under 2 months of age, under 60 days, we really worry about a rectal temperature that's greater than 100.4.
And this is the same for kids under 3. Temperatures of 100.4 are considered fevers. For older kids and adults, 100 degrees flat is considered a fever. And it's important to note that this is just based on rectal temperature. And if you're taking an oral temperature, a tympanic temperature, it's going to be a little bit lower. Typically, this is just anecdotal, but I'd say it's about a degree lower.
Exactly. Right. How do you take a temperature? And this is another question we're often asked, but don't be afraid about taking a rectal temperature. It's actually much easier to do than you may think. You would take a rectal thermometer, lubricate it with some Vaseline, insert it into the rectum until you meet resistance. It is not painful. It's not scary. You can do it, and your provider can walk you through it if you're having challenges with that. Ear thermometers are great. Just make sure that you're pushing it far into the ear canal as possible. Oral temperatures are difficult for children because they have to keep their mouth closed, and many children can't do this. So fevers are not always a bad thing, right, Kaylee? I mean, there's some good aspects about a fever.
Definitely. Some people actually call fevers the on switch of the immune system, and they can actually help your body fight infections, viral and bacterial. Animal studies have actually shown that if you allow a fever to kind of run its natural course, that there are higher survival rates with some infections. These kinds of studies have not been done on humans, though. But fevers in themselves do have some potential harms.
Yeah, so children are uncomfortable when they have fevers, right? They don't feel well. They tend to be more tired. I know with my own children, the first sign that they're spiking fever is that they will sleep or they'll take a nap or they'll complain about being tired. Dehydration is the other thing that we'll see and worry about with fevers because the metabolic rate is increased and you lose more fluid as a result of that. So dehydration as a result of a fever is concerning. And then for some children that have some underlying conditions, there can be some cardiac and respiratory complications, although in healthy children, we generally don't see that. And then concerning to a lot of parents that have heard about febrile seizures, many parents will be concerned that this will happen to their child when they have a fever. So Kaylee, what causes febrile seizures?
So we actually don't really know, but a lot of healthcare providers have associated febrile seizures with rapid elevations in temperature. We also know that children who have a first-degree relative with a history of febrile seizures are a lot more likely to have febrile seizures. They typically happen when kids have fevers over 101, although not to all kids with fevers over 101. I'd like to stress that. And actually, only about 3% of children have febrile seizures.
So what's important to remember about febrile seizures is that they're generally very brief. Usually they're under a minute long, and very rarely are there any long-term neurological complications for children. That being said, they're terrifying for parents to watch, and it's always something that you should reach out to us about. Most of the time, febrile seizures do not require any treatment other than medicating the fever. There is small risk for reoccurrence. If a febrile seizure happens under the age of 1, that recurrence rate is about 50%. However, if it happens after the age of 1, it's about 30%. Kaylee, when would you want to tell a parent to treat a fever?
So Although we say let it run its course, we are pretty aggressive about treating fevers, and that's mostly because kids are so uncomfortable. So we definitely treat for discomfort in the way your child looks. Like if your child looks sick, you can go ahead and treat them and make them feel a little bit better. We also treat fevers when we're concerned for dehydration or fluid and electrolyte imbalance in general, and we treat fevers if there is an underlying cardio or pulmonary concern. When would you consider a fever too high?
Yeah. So, if we had to say a number, what I generally will tell parents is that often with viral infections, fevers can climb as high as 104, 105, which again, super scary as a parent. But as long as you can bring that temperature down with Tylenol or ibuprofen, and your child is otherwise well, they're not incredibly lethargic, they're drinking, they're maintaining their hydration levels, then that would be reassuring. Really, that research indicates that any significant brain damage is actually going to happen for temperatures 108 and greater,
Which is reassuring to hear, but yeah, we're not letting people hang out with a temp of 106. You're going to get dehydrated and you feel like junk.
Right.
Do you alternate doses between Tylenol, Motrin? A lot of people do this.
Yeah, a lot of people will. What I'll generally say is if you give one or the other, and within an hour the temperature is not coming down, you can add in the other one. Some people will do the every 3-hour rule where they're using acetaminophen and then 3 hours later ibuprofen to manage a fever over the course of a day or two.
Yeah, sometimes I'll suggest this for people that just have really persistent fevers that aren't making it to that next dose. Tylenol would be every 4 hours, Motrin every 6 hours, and they just can't make it to that next dose without that fever skyrocketing and the kid getting really uncomfortable again. However, there's no real increase in effectiveness if you give both of them together, so we don't recommend that. I usually say for kids with mild to moderate fevers, stick with one and use the other for breakthrough doses, for breakthrough fevers only. A lot of parents will ask, my child has a fever, should I bring them to the hospital? It's really high. What do you say to that?
Yeah, and we always advise parents, call us because we're happy to walk you through that. But in general, a fever that's accompanied by dehydration is really concerning for us, especially in the youngest children. Uncontrolled fevers that are over 108, although we're pretty sure you would reach out to us prior to that point, would be concerning, or fevers that are unresponsive to pain medication or fever control medication. That would also be something that we would generally refer to the hospital for.
And we're not expecting the fever to go away with antipyretics like Tylenol and Motrin, but we are expecting it to go down about 0.5 degree within an hour at least.
Yeah, really important to mention because sometimes we'll have a child that's 104 and you give those medications and the temperature only goes down to 100 or 101. But for us, that's reassuring.
Definitely. And another reason to go to the hospital is if your child's having a febrile seizure for the first time, or if your child's having a febrile seizure for 2 to 3 minutes, because that could be concerning. Also, of course, if your child's seizing and is experiencing difficulty breathing or is turning blue. But I think you guys would bring them to the hospital for that. Thanks for watching this episode of Crip Notes.
Don't forget to like and subscribe and leave your comments down below.
And always remember, your child's care is nuanced by their unique physical makeup, as well as your family's particular social, economic, and environmental situation. For that reason, you should always consult your own pediatric providers when making decisions about your child's care.